Do you know the 5 warning signs of a heart attack? Well, Nurse Jackie Hickey of Bayshore Home Health is here to explain. So Nurse Jackie, what 5 signs should we be looking for?
There are some very significant signs that people will exhibit. One of them is pain or discomfort. And it could be in the sense of pressure, squeezing, fullness, heaviness. And it can also radiate. So people may have pain in their back. They may have it, in their left arm or down their arm or in their jaw or their neck. But anything that's consistent and remains becomes a concern. The other thing that people tend to experience is that shortness of breath. So they're talking and now all of a sudden they can't speak in full sentences or words because their body is reacting. And I think the other really significant thing is, as the body starts to react to this occurrence, they start to sweat. They start to almost have that kind of a panic or anxiety sense. Their skin becomes cold, it's clammy. The anxiety may make them feel almost like there's impending doom. Something is happening. We're in tune to it. We know that something's happening. And nausea and vomiting, that sensation or that urge to maybe throw up or vomit, or that sick feeling in one's stomach. And then, the lightheadedness. As the symptoms progress, our body will slowly start to react. So these are the warning signs that you really want to pay attention to.
Now, what should someone do if they're having these signs? And is it all or any?
It may not be all, it may be 1 or 2, but the thing is if it persists and it causes you to stop and recognize it, you need to stop what you're doing. You need to sit down, you need to rest, you need to call 911 or alert medical attention. And, there are individuals that may be predisposed or may be diagnosed with heart conditions. So if they have medication, for example, like nitroglycerin, then they should take it as it's prescribed. Also, a general public rule is individuals can take an aspirin, chew an aspirin, swallow an aspirin, either the regular strength, the 325 milligram, or the baby aspirin, the 80 milligram. And these are steps that people can take because, it's important that we recognize and we don't ignore and we don't deny what's happening to us.
What can we do to prevent this from happening to us?
Well, I think prevention is very important. And some of the things that we need to realize is learning about our family history, learning about some of these diseases and disorders. And if it's in your family, you really should understand it and know it well. And so, there's different types of risk factors that either predispose us or may cause us to develop these diseases or a heart attack or heart conditions. And so, understanding, learning, and realizing that, our age, our gender, and our genetics can't change, but our lifestyle, our exercise, our diet, smoking, other conditions like diabetes and blood pressure, high blood pressure, these are things that we can, to some degree, control, either through medication or preventative measures.
Well, thank you so much for giving us this great information about heart health.
You're welcome.
Now, if you'd like to learn more about heart health, visit bayshore.ca. Keeping you informed, I'm Sheila Clark, and you've been watching Daily Web TV.